أهلا بيكم. Uh, Today we're going to continue with the nasal cavity. So let's start. After learning the structure of the nose and uh, about the walls, the contents of the nose, now it's time to study the vessels. It's very rich in blood supply, and the sources are from two arteries, the external carotid and the internal carotid. The internal carotid gives off a branch called the ophthalmic artery that gives off the anterior and ethmoidal arteries we're going to talk about. And from the external carotid, the Sphenopalatine and greater palatine from the maxillary, superior labial and lateral nasal arteries from the facial artery are branches that will supply the nose. The Sphenopalatine artery, it's the terminal branch of maxillary of the pterygoid of the pterygopalatine fossa. Then goes through remember the sphenopalatine foramen we talked about in the lateral wall of the nose, right above the posterior end of the middle concha in the superior meatus, and it gives lateral nasal and septal branches to supply the lateral wall of the nose and the medial wall of the nose as well. The greater palatine artery, branch of the maxillary in the fossa 2, and through the palatine canal to the greater palatine foramen, where it ascends and anastomoses with the terminal ends of the arterial supply of the medial wall of the nose. Superior labial. This is the superior labial branch. Okay, of the facial. This is the lateral nasal branch of the facial. They both supply the external nose, and around the margin of the nose they supply the cavity, the nasal cavity. And here in this specimen you can see the greater palatine nerve and vessels running to forwards, and for the artery will ascend up through the incisive canal to anastomose with those of the nasal septum. Okay, we said I told you that the internal carotid gives off an ophthalmic artery, and which gives off the anterior and posterior ethmoidal arteries. The posterior ethmoidal artery supplies the posterior ethmoidal air cell group and the sphenoid. This is the posterior ethmoidal artery, and here crossing is the anterior ethmoidal artery. They pass through special foramina for them, anterior and posterior ethmoidal foramina in the medial wall of the orbit, and they supply the corresponding air cells, and then supply the nose as well. They both supply the lateral and medial walls of the nose. All these vessels, by the way, they anastomose. They have extensive anastomosis in the nose. The veins, they accompany the corresponding arteries, and those with the ethmoidals drain into the cavernous sinus. And I think I told you before that there is a connection between the superior sagittal sinus and the veins of the nose through the foramen cecum. In front of the crista galli, between it and the frontal bone. When a communication is mentioned, you mean you worry about spread of infection. Innervation. Nerves involved in the nose are the olfactory branches of the ophthalmic, maxillary, all these for general sensation, as well as the parasympathetic that originated from facial through the greater petrosal, then through the branches of the maxillary nerve. Now, the olfactory nerve, it's formed in the roof of the nasal cavity from the olfactory mucosa, which has the cell bodies of the olfactory nerve to be formed inside the cranial cavity. It sends off olfactory filaments from the receptors, which are chemoreceptors for smell, sent it off through the cribriform plate of the ethmoid and then gathers in the olfactory bulb that will give rise to the olfactory tract to the cortical areas. This is the olfactory nerve. The anterior and posterior ethmoidal nerves from the nasociliary nerve that is of ophthalmic, off trigeminal, the fifth cranial nerve, and they both, as the name indicates, the posterior ethmoidal, the same like the artery, goes through posterior ethmoid foramen and to supply the posterior air group, air cells, and the sphenoid sinus. The anterior supplies the anterior and middle and shares in the supply of the frontal too. This is regarding the ethmoidal sheath. In this illustration here, this is the Sphenopalatine artery. This is the Nasopalatine nerve, branch of maxillary, to supply the septum. This is the anterior ethmoidal and posterior ethmoidal vessels. These are the end branches of the nasal nerve, as internal and external nasal, that will supply the skin of the nose. Here you can see the anterior ethmoidal nerve is going through the anterior group of ethmoidal air cells. Okay. The nerve supply comes through branches of the maxillary nerve as well. Maxillary gives off superior lateral and posterior superior lateral and posterior superior medial branches. As the name indicates, they supply the lateral and medial walls as well. The nasopalatine nerve that passes through the sphenopalatine foramen and descends on the septum as down as the incisive foramen. It passes through the incisive foramen and supplies the gingiva and the mucosa of the oral cavity posterior to incisors and canine teeth. Remember this in the oral cavity. And the parasympathetic fibers are of the facial through the greater petrosal nerve that receives a branch from the internal carotid plexus as the deep petrosal. Then they together form the nerve of the pterygoid canal, and then they reach the trigeminal ganglion where they branch with the corresponding branches of the maxillary to be distributed. And the sympathetic, I told you, it's the deep petrosal nerve part, which is a branch of the plexus around the internal carotid artery that brought it from the superior cervical sympathetic ganglion. This is how it reaches the nose, the autonomic supply, the para and the sympathetic. The lymphatic, from the anterior nose to the submandibular lymph nodes, and from posterior nose to deep cervical lymph nodes. That was easy. Okay, now it's the paranasal air sinuses. They are cavities within the bones of the skull and lined by respiratory mucosa, and of course they have a drainage system. Well, the purpose of the paranasal air sinuses, some explained it as to reduce the weight of skull, for example, but the weight can be compensated by eyeglasses. Single eyeglasses equals the weight taken from bone, and the actual purpose they settled on is that it's for phonation of voice. It adds character to voice produced from the larynx and as if amplifies it. There are four paranasal air sinuses on each side. We have frontal, ethmoid, labyrinth, sphenoid, and maxillary air sinuses. All these sinuses characterized by, they are lined by respiratory epithelium, which is pseudo-stratified columnar ciliated epithelium, and they all open into the nasal cavity, and they are innervated by branches of trigeminal nerve. The first of the sinuses, frontal sinus. This is the frontal air sinus on each side. They are rather triangular in shape, with the base at the midline facing each other, and extend laterally as far as 1/3 or half of the eyebrow or the superior orbital margin. They are not equal in size or shape, they differ. And by the way, they are the only ones that are not present at birth. They develop after birth. A part of the growing process, as part of the growing process of the skull, they drain inferiorly through the frontonasal duct. And remember the frontonasal duct, where does it open? Exactly in the anterior end of the hiatus semilunaris, in the infundibulum, right? Joined by the anterior ethmoid, if commonly. Okay, nerve supply from the ophthalmic nerve, and blood from the anterior ethmoidal arteries. The ethmoidal air cells, these are the ethmoidal air cells here. They are between the medial wall of the orbit and the lateral wall of the nose. They actually occupy the space between these, and extend from anterior to posterior. See, these are the ethmoid labyrinth or ethmoid groups. They are divided according to their drainage system. Where do they open? And they are classified into groups: anterior, middle, and posterior ethmoidal air cells. This is the sphenoid sinus, by the way, showing here too. See the middle ethmoidal group. It protrudes the lateral wall of nose as the bulla ethmoidalis. See, this is the bulla ethmoidalis formed here, and this is the hiatus semilunaris. Okay, and these are the rest of the groups. It's very well shown here. The anterior ethmoidal drain with the frontal, or separate in the anterior end of the hiatus semilunaris. The middle drains into the bulla ethmoidalis itself at the top of the bulla ethmoidalis, and posterior they drain into the superior meatus, as we mentioned in the during learning the nose, lateral wall of the nose. The nerve supply by the anterior and ethmoidal nerves. The anterior supplies the anterior and middle, and the posterior supplies the posterior, as well as the sphenoid, paranasal air sinus, and blood from the anterior and posterior ethmoidals, from ophthalmic, from internal carotid artery. Okay. The maxillary sinus is the largest one, and occupies the body of the maxilla. It's like a pyramid in shape. It has a roof, which is the floor of the orbit. It has an anterolateral surface, which is the roots of the molars and premolars, and anteriorly on the face. The roof was the superior lateral surface. This is the anterior lateral surface. And it has a medial surface, which is formed, is the lateral wall of the nose, actually, by the ethmoid and the inferior concha. the draining, the opening to drain the maxilla is high up on the medial side. Means that this is why this paranasal air sinus is the most one that gets complicated and chronic. This is the one that remains chronic for a long time because the infected fluid accumulating inside the sinus has to be built up before it drains into the lateral wall of the nose, because the opening is high up on the medial side. Got the idea? So infectious mucus may accumulate before it drains. That's why it gets chronic. Relations of the maxillary sinus, as we said before, superiorly is the orbit, and anterolateral side the roots of the premolars and molars and face, and posterior is related to the this is what I forgot to say, posteriorly it's related to the infratemporal fossa. Nerve supply by branches of the infraorbital, alveolar and alveolar branches of maxillary, and blood from infraorbital and superior alveolar arteries. You all know about these arteries now, because we are still in the area. The sphenoidal sinus is the last of the sinuses. It's two sinuses in the body of sphenoid, separated partially or completely, and open into the roof of the nasal cavities in the sphenoethmoidal recess by itself. And we said it belongs to the roof and not to the lateral wall of the nose. It's related superiorly to the pituitary gland and the optic chiasma, that is the crossing of the optic nerves above it. So actually this is a surgical inlet or surgical access to the pituitary gland through the sinus itself, from the face. Laterally it's related to the cavernous sinus with contents, 3 and 4 and 6 cranial nerves and internal carotid artery, and below it's related to the nasopharynx inferiorly. Okay. The nerve supply by posterior ethmoidal of ophthalmic, and the blood supply by the pharyngeal branches of maxillary arteries. That would be all for today. Thank you very much for watching.